Hello everyone, I am Dr. Archana Daftardar. I am a consultant nephrologist at Renova Hospital, Kompally. Today I am going to discuss a topic about urinary tract infection or UTI. It is one of the common infections seen in the community. So what is urinary tract? So, urinary tract comprises of kidney, ureter, bladder and urethra. So kidneys are two bean-shaped organs which are placed in the abdomen on the backside, and the ureters are the two tubes which carries urine from kidney to down to the bladder. Bladder is like a bag, muscular bag which collects the urine and it accumulates the urine, and then from the bladder through urethra, again urethra is a small tube through which the urine comes out of the body. So this is the urinary tract, and whenever there is an infection in this tract, it is called as urinary tract infection. So the commonest site for the infection is the bladder. So it is called as cystitis, while the infection of the kidneys is called as pyelonephritis. So let's see what are the symptoms of urinary tract infection. So if it is a cystitis, that is the bladder infection, then urgency, frequency, pain while passing urine, lower abdominal pain are the common symptoms. While if the UTI or if there is an infection of the kidneys, then then the patient presents with bilateral or both side flank pain or one side flank pain, back pain, low back pain, side pains, vomiting, nausea, fever. These are the common symptoms. Whenever such symptoms are there, the doctor will advise you to do certain blood test as well as the urine test to check the diagnosis or to check for the infection, and also scanning also may be required sometimes. The ultrasound abdomen scanning may be required sometimes. Coming to the treatment of this urinary tract infection, usually the cystitis or the bladder infection can be treated with oral antibiotics for 3 to 7 days, and the more serious, that is the kidney infection, that is pyelonephritis, needs injectables or even sometimes it can be treated oral if the patient is stable. But most of the times it is treated with the injectable antibiotics, and the duration of the antibiotics also may vary from 7 to 10 days. What are the risk factors for this UTI or the urinary tract infection? In children, because of the anatomical deformity of the urinary tract, it can lead to urinary tract infections. At young age, because of the stones, because of the presence of kidney stones, because of the use of the public toilets, and in diabetic patients because of the uncontrolled sugars, in elderly patients because of the prostate glands, and in perimenopausal women because of the estrogen deficiency, the occurrence of UTI is more common. While in young females, usually in females the UTI happens more commonly because of the short urethra, and in young females who are sexually active are at more risk of this infection. So let's see how to prevent UTI. Excessive water intake, adequate water intake is must to prevent the urinary tract infection. If you are a diabetic, then control of sugar is must. Then if you are using public toilets, then take proper hygienic precautions before using the toilet. Keeping the genitals clean and hygienic is also a way to prevent the urinary tract infections. Particularly passing urine after having intercourse is also helpful in preventing the urinary tract infection. Thank you.